Officer at the Rock Island County Health Department. We are grateful for your support in sharing information with the public on the continued COVID-19 situation. Nita Ludwig, Public Health Administrator for the Rock Island County Health Department, and Amy Thorson, Deputy Director of the Scott County Health Department, will share some brief comments on the recent Scott and Rock Island County cases, as well as additional recommendations given by the states of Illinois and Iowa. We encourage you to type your questions into the chat so that we may answer your questions after the prepared comments. Nita, please begin. Thank you.
Nita, just make sure to unmute yourself. *6 works.
Can you hear me now?
Yes, we can. Thank you.
Okay. Hi. This weekend, both Rock Island and Scott County Health Departments were notified of the first positive cases of COVID-19 in residents of Rock Island and Scott counties. The Rock Island County resident is in his 60s and being treated at a local hospital. The Scott County resident is a middle-aged adult, 41 to 60 years of age. The individual was seen at a Scott County medical clinic last week and is self-isolating at home. This case appears to be a case of community spread, as the individual had not had recent travel. Regarding our WIC services, the Rock Island County WIC program is waiving all clinic visit requirements for all participants and WIC visit types because of the COVID-19 pandemic. This plan remains in effect until further notice. Required initial and 6-month certifications will take place by telephone interview. Clients are asked to understand that calls could take up to 45 minutes. Clients are asked to provide the most recent height, weight, and hemoglobin information from prenatal, postpartum, or well-baby-child visits if possible. A WIC staff member will provide age-appropriate nutrition education over the phone. At the Rock Island Clinic, clients will be issued food benefits through a drive-through lane. At the Moline and East Moline clinics, housed at community health care clinics, clients will be screened before they enter the waiting room. And now I'll turn it over to Amy Thorson with Scott County Health Department.
Good afternoon. Iowa Governor Kim Reynolds extended the social distancing proclamation to now include the closing of additional establishments beginning last night at 10 p.m. until midnight on Tuesday, March 31st. Those include salons, medical spas, barbershops, tattoo establishments, tanning facilities, massage therapy establishments, and swimming pools. These additional closures are intended to help our communities to further social distance and minimize the spread of COVID-19 by limiting our actions with one another. This weekend, there was new self-isolation guidance provided for Iowans. Iowans are encouraged to self-isolate for 14 days in the following situations. If you have traveled outside of Iowa for business or vacation in the last 14 days, if you have taken a cruise anywhere in the world in the last 14 days, if you have traveled internationally to a country with a level 3 travel warning in the last 14 days, or if you live with someone who has symptoms of COVID-19 or has tested positive for COVID-19. We know these recommendations can raise questions, particularly in border communities. We would like to provide some additional information for self-isolation for those who have traveled outside of Iowa for business or vacation in the last 14 days. This does not include regular daily business that takes place within the Iowa and Illinois Quad Cities. However, this is applicable to those returning from business and spring break trips outside of Iowa. We would like to describe the difference between social distancing and self-isolation. Self-isolation means isolating yourself in your home and away from others for 14 days, beginning with the day you returned home. So for example, if you returned home from a travel in Florida on Friday, Friday is day 0 and Saturday is day 1. You should heed the following recommendations. Stay home and do not go to school, public areas, or attend gatherings. Do not use public transportation, ride sharing, or taxis. Postpone all travel. Wash your hands often and practice good hygiene. Call to postpone all non-essential medical appointments until you have completed your 14 days of self-isolation. If you have an essential medical appointment during this time, please work with your healthcare provider and local public health professionals as needed to help coordinate the visit. In addition, the Iowa Department of Public Health has provided guidance on how the earlier guidance regarding travel and social or self-isolation relate to individuals identified as essential services personnel. Essential services personnel include the following categories: healthcare providers, law enforcement, fire and emergency medical service personnel, long-term care personnel, residential support facility personnel, public health and emergency management personnel. These individuals are recognized as essential to the COVID-19 response. If individuals in these groups are exposed to COVID-19, they will still be allowed to go to work as long as they do not have symptoms and check their temperature at the beginning and end of their shift. Now I'll turn it back to Nita.
Thank you. In Illinois, the following groups are a partial list of who is exempt. We refer you to the complete list at illinois.gov. Essential businesses and essential government functions, first responders, emergency management personnel, law enforcement personnel, healthcare workers, grocery stores, pharmacies, and any employee of an essential business. When am I allowed to do and where am I allowed to go? Essential activities are allowed. Work. So if you work for an essential business listed above, you are allowed to work. Grocery store to obtain food or supplies. You can go to healthcare offices, pharmacies in order to pick up medications. You can go outdoors, walking, hiking, running, or biking, and any outdoor recreation area except playgrounds, as long as you can keep the social distancing of 6 feet between individuals. Taking care of others, providing care or transportation for a family member, friend, or pet. Gas stations and auto repair facilities. All non-essential businesses and operations have been ordered to cease. Business can continue with employees working from home. Minimum basic operations include the minimum necessary activities to maintain the value of inventory, preserve plant and equipment condition, ensure security, process payroll and employee benefits, and facilitate employees working remotely. Examples of non-essential business in Illinois include fitness centers, salons and spas, barbershops, tattoo parlors, and daycare centers. The order also closes licensed child care providers and child care homes serving more than 6 children. The Pritzker administration is working to expand the availability of child care for essential workers while protecting the health of the children and the child care teachers and home providers. A new emergency child care center license is being created with more flexibility, but much smaller group sizes to ensure social distancing for children in care. Can you travel? Only essential travel is permitted at this time and must be done in accordance with the social distancing requirements. That includes travel related to performing essential activities, essential governmental functions, essential businesses and operations, or minimum basic operations, caring for the elderly, minors, dependents, persons with disabilities, or other vulnerable people, receiving materials for distance learning, for receiving meals, and any other related services from an educational institution, returning to a place of residence from outside the jurisdiction, following the direction of law enforcement or court order, including to transport children pursuant to a custody agreement, and returning to a place of residence outside the state for non-residents. I would like to also talk a little bit about testing and personal protective equipment. We would like to talk about some of the confusion about COVID-19 testing. There may be many of us who are exposed to COVID-19 and contract the virus and either have no symptoms or have very mild symptoms. If this is the case, we will not likely need a COVID-19 test because we know COVID-19 is already in our community and is spreading. We are best served by staying home and recovering there, making sure that we aren't exposing others to the virus. We also know that every time a patient is tested for COVID-19, the individuals helping take the test are using some of our limited supply of personal protective equipment such as masks and gowns. These resources are important for healthcare providers and hospitals to have for the sick patients and those who will have extreme symptoms, not those who do not have symptoms or could best recover at home. If you have questions about how best to ease your symptoms, which can include fever, cough, shortness of breath, make sure to call your healthcare provider for advice. We suggest you do not make homemade COVID-19 remedies that have been going on around the internet. As far as social distancing, we wouldn't be doing our jobs if we didn't stress the importance of social distancing and staying home at this crucial time. If you do not need to go out, stay home. Limit your trips to the grocery store and similar locations and go only for essentials. Until we, as a community, state, and nation, social distance as a unified group, the end of our social distancing period will be further into the future. We can protect our communities and our most vulnerable residents by responding as a community now. We will now have some comments from Kirby Wynn with the Mississippi Valley Regional Blood Center.
Hi, thanks for the invitation to join in the news conference. Assume you can hear me all right. I'm just going to read a couple of paragraphs from a news release we have going out. As communities across the Mississippi Valley Regional Blood Center service region continue to manage the COVID-19 pandemic, Blood Center reminds donors that blood donation is an essential activity approved even as stay-at-home directives are in place. However, the Blood Center is moving to a policy of requiring appointments for blood donation. The new policy is intended to limit walk-in donations and will thereby help staff at donation centers and mobile blood drives manage donor flow and maintain appropriate social distancing between staff and donors. Donor response to public appeals for blood donation has been strong over the last week. This has helped the Blood Center maintain inventory levels, even as it experiences a high rate of blood drive cancellations related to the COVID-19 pandemic. Nearly all blood drives scheduled at high schools, colleges, and universities over the next 6 to 8 weeks have been canceled. Blood drives hosted by businesses have been significantly impacted as well, as nearly all workplaces adjust production schedules and implement work-from-home policies whenever possible. So what is new in all of this, and I will send a news release around to local media here right away, is the requirement for appointments for donation. We typically accept walk-ins, but we'll be moving away from that policy now to manage donor flow, donor presentation, and enhance our ability to promote social distancing as much as possible in the donor experience. That's all from me. Thank you.
Okay, thank you. This is Brooke Barnes, Public Information Officer for the Scott County Health Department. I'll now begin to go through some of the questions in the chat and direct them both to Nita, Amy, and Kirby if there's any questions for that. So if we go to the top here, we have, how does the situation in our rural communities differ from the urban quad cities? Do you have anything for that, Nita, that you'd like to describe?
Well, I think just the social distancing and activities are the same, whether you're in town or in your rural community, is to practice the good hand hygiene and social distancing.
Thank you. What are the travel rules or guidelines for people who live in the Quad Cities and other parts of Iowa where we regularly cross state borders? Amy?
Again, as we shared earlier, this is really designed to look at travel from a broader perspective, not that travel that we do in a daily basis. I went to a bank in Illinois, I came to the gas station in Iowa. It's for it's for longer periods of travel that are outside of our immediate area.
Thank you. Is it possible if you test positive for strep and/or influenza, you could still have COVID? So a positive test for one of these two can't rule out COVID? Do Nita or Amy have some information on that? I know we don't do the testing here.
I would just say that we don't know the answer to all of that at this moment in time. It is presumed if you have a positive test for strep and/or influenza that is what you have, and you would be sent home to isolate for those conditions or given medication for strep.
Thank you. Amy, is there an investigation of who confirmed cases may have had contact with? And then are the state or local health departments reaching out to those people?
In Iowa, we receive information of a confirmed case, and then we contact the medical provider as well as the patient to determine who may have interacted with that patient. Knowing that we have community spread, we're not really concerned about where someone may have caught or been exposed to the illness as much as who are their close contacts and how do we assure that those people are taking proper protection.
Do you have anything to add to that, Nita?
No, I would just echo the same procedures are being done here in Illinois, and that is what we do on a routine basis in our infectious disease department. We follow up with reportable cases such as COVID-19, and we do all that same. It's called contact tracing. You retrace the person's steps either with the provider or with the patient or family, and do all those same activities that Amy spoke about.
And I know we've discussed this next question about tests on some earlier calls. Perhaps we can just reiterate how many COVID-19 tests have been administered and how many tests are pending in the Quad Cities. Should we start with the Iowa process for this?
Tests are ordered by physicians and sent through private labs, and we don't have any information on how many of those tests are being done and how many results are pending. There's also some limited information or limited groups that will have testing done through the state hygienic laboratory, and local public health is not involved in that, and the state health department doesn't have to approve that either. So we don't have any information locally on the number of tests that are pending.
And Nita, do you want to describe that as well for Rock Island County as you did on Friday?
Sure. It is a little different on the Illinois side. So if a provider, hospital, urgent care, if they would like to have a person tested from the Illinois Department of Public Health Laboratories, either in Chicago, Springfield, or Carbondale, they do need to get an authorization code from the Rock Island County Health Department. There is also now an online method that they can do through the Illinois Department of Public Health. So a provider can now enter all the information to request a test online and get approval that way as well. So there are two ways to do that with the state lab. But if a provider orders a lab test through a private lab, then they do not need an authorization code. And the reason we are not any longer sharing numbers is because we only would have the number of the authorization codes that the health department has given. So if people are getting codes from the state, or if they're sending people for private labs, we are not going to know the amount of tests that are being done from those sources. However, we will get any positive results through our disease tracking system.
Thank you, Nita. Are any local hospitals or businesses working to develop a COVID-19 test? Amy?
We have not been contacted by any local businesses regarding their desire to establish a test, but we would not be involved in the approval process for that. And I'm not aware if the hospital laboratories have that capability. That would have to be something the hospitals answer.
Okay. I think we addressed this a little bit just a minute ago. Maybe, Nita, you could kind of reiterate this. Are rural communities more or less at risk for COVID-19?
At this point in time, I don't think there's any difference. It is in our community as well as every community in both Iowa and Illinois.
Are restaurants and bars on both sides of the river abiding by the restrictions to only do pickup or drive up? Has anyone been cited for continuing to operate? How about on the Iowa side, Amy?
In Iowa, the health department receives information regarding concerns residents may have, but we're not involved in any of the citations. That would be handled by police departments. But overall, the questions we've had are more about people perhaps waiting when they've ordered a carry-out meal or something like that. And we can usually have a conversation with the establishment and get those requirements cleared up quickly. Overall, we have a lot of establishments in our community and we've received very few complaints.
How about for Illinois, Nita?
For Illinois, I don't believe there have been any citations given to anyone that's non-compliant, and the same is true on the Illinois side. I think everyone is trying to support the local businesses and still do takeout or drive-through, and I haven't been made aware of any complaints or problems.
Okay, it looks like we have about 2 more questions. Nita, this one's for Illinois. Pritzker says he is loosening restrictions to allow border town doctors to work in Illinois, and specifically said it would help communities like the Quad Cities. Did the Quad City healthcare community work with him on that? How do you see it working day to day?
You know, I really don't have any knowledge of how that occurred.
I think in overall, the governors of both states recognize that people live in one state and work in another state, and they're trying their hardest to make sure that the recommendations or requirements that they put forward work for those communities.
Thank you. What is recommended by the health department for people with presumed positive cases who have been denied tests? Are presumed positive cases being counted or investigated? Amy?
At this time, only confirmed cases are being investigated, but we do recommend that if you're having the symptoms of COVID-19, you stay home, you call your medical provider if those symptoms are more than you can manage at home. But every time, as Nita mentioned, that we test someone, we're putting additional people in that line of exposure, and more importantly, we're using personal protective equipment that is in short supply. So if you have a mild infection and you don't feel bad, we just recommend that you stay home while you're sick. That's for at least 7 days after your symptoms started. If you no longer have symptoms and you no longer have a fever, and it's been at least 3 days with no fever without using fever-reducing medication.
We had one last question that came separately. Are there any new cases in the Quad Cities? And I believe it's no on the Iowa side, for Scott County, excuse me. And Nita, is it the same in Rock Island County?
Right. So far, we just have the one positive case.
Okay. Well, thank you. We're continuing to discuss how best to share information with all of you as new recommendations and news on COVID-19 becomes available. We do not know if this will involve daily press briefings, but we obviously can't tell what the future will hold with any of the updates that might take place. Please know that we will reach out when new information is available, and you're the best partners to help us share information with members of the public. Continue to watch our websites and social media pages for any of that information, and we'll continue to share that. So thank you so much for your time and have a good day.